The objectives of the work were to provide a systematic review of enhanced optometric services, and then to delve into some detail, almost in a case study base really, looking particularly at schemes that were newly developed or newly relaunched. And our two primary case studies were a MECS one, a minor eye condition scheme one, in Lambeth and Lewisham, and also a glaucoma referral refinement scheme in Manchester, which had been running for many years but was being relaunched for reasons which I'll come to. And it's really a mixed methods evaluation, because we were interested in the clinical effectiveness, clinical safety issues, some, if you like, quantitative aspects of care. But we're also interested in qualitative aspects. You know, what did these stakeholders think? And importantly, of course, these days, the health economics of the scheme. You can look at the paper. It's published in Ophthalmic and Physiological Optics. So this is available for you to look at. So the highlights of the systematic review. What we found was that enhanced service schemes provide ophthalmic care commensurate with usual care. So that's a big first point to make. That the schemes are well received by patients and by other stakeholders. In other words, clinicians working within the scheme and out with the scheme, working in hospitals, general practitioners as well, but significantly patients. And that further work, however, is needed in respect of cost effectiveness and the sustainability of the schemes, particularly in some areas. There's some evidence on cost effectiveness, but it's not as strong as possibly other areas of effectiveness. So if we look now at one of the case studies, we were very fortunate at the outset, a scheme that was about to be implemented in London there. So I think you've got the west side there, you've got Lambeth, and on the east side of southeast London there, you've got Lewisham, and between Southwark. So we've got actually three areas there, three commissioning areas, and the scheme was set up in two areas, but not the central one. And all three areas are actually very, very comparable in terms of the demographic, in terms of deprivation, etc. And it provided an opportunity to really look in some detail at data being collected prospectively, and then to look at hospital episode statistics, etc. So we've got some high quality data, we feel. You can see here the results, and they're pretty encouraging, because all of these people presumably would have pitched up to an A&E. And we know that maybe a third of patients presenting to A&E, audit work had shown, didn't really need to be seen in such a context and could have been seen by community optometry. And this data, in terms of the MECS study, confirms that was the case. So you've got 64% were managed by the optometrist in the practice, 11% discharged, so if you like, 75% effectively could be handled in optometry, either through treatment or discharge, and then only 18% referred. They're the two different main hospitals, and then we've got 1% going to other hospitalised service providers, and a limited number who were referred back to the general practitioner. So there were the outcomes of patients seen within the service during the timeline. In terms of decision making, for all of those patients referred to the hospital eye service, we've got the vast majority of them, we were able to get some outcome data on what happened to those patients. And this is through engagement with the ophthalmologists working at those centres. And 89% were deemed to have been appropriately referred, which I think is extremely high level. And 78% of those were referred with an appropriate urgency. And of those not referred with an appropriate urgency, most of them were overcautious. So in other words, there was very little evidence of concern in terms of safety of the patients seen within the scheme. So they were for patients referred into the scheme. We've also got, of course, the vast majority of patients not referred into the scheme and how they were managed. That's a bit more difficult to tap into, but we had a go. We had an optometric consensus panel to review the record keeping, review clinical decision making, set against recommended standards for assessment and for management of such cases, and the treatment, of course. And 95% were deemed to be appropriately managed. And of the limited number that weren't deemed to be appropriately managed, there were no major clinical safety issues. So it might be what in the context of the scheme was seen as relatively minor, possibly an unnecessary prescription for an antibiotic according to, for example, college guidance. So there was nothing there that was deemed to be a major safety concern. So that's a really good safety outcome from this work. In terms of health economics, this is still being pushed through the review process. So this paper is still under peer review at the moment and dealing with reviewer comments. And you had this figure last year, actually, but first attendances, as referred by general practitioners, had dropped by 27% in Lambeth and Lewisham, the two areas where the scheme existed, compared to the neighbouring area without the scheme. That was for a first ophthalmology attendance. There was also a drop for follow-up ophthalmology attendances, to some extent, to a lesser extent, when initiated by the general practitioner in the first instance. And there was some evidence from a cost perspective as well of savings, particularly in one of the boroughs. We were interested not only in what the clinical and the safety outcomes were, but also in what stakeholders felt. The results were resoundingly positive. In fact, patient satisfaction was extremely high. You're talking about virtually all of the benchmarks, things like the friends and family test that David Cameron introduced into the NHS some time back, that type of model of patient satisfaction. It was all a great big thumbs up. So have a look at those papers. It reflected extremely favourably on MECS, but also on glaucoma referral refinement, which was included as part of the evaluation considered therein. So just on to our second case study, and I think I've just got a few minutes, hopefully, to say something about this. This service is now referred to as an enhanced case finding service, really. So we're referring to it as a glaucoma enhanced referral scheme rather than a glaucoma referral refinement scheme for technical reasons. It does what it says on the tin. It is an enhanced case finding service, and it's been running in Manchester for many years. And this was an early analysis showing all of these people here. The 670 in this initial sample would have been referred through to the hospitalised service. So in the early analysis of the Manchester scheme, 41% were deflected and deemed not to need referral. And if you follow that through to look at the outcomes, the key figure there is the 11%. That effectively then is the false positive rate. Well, that's substantially lower than the typical 1/3 to 40% false positive rate historically that used to be the case in many hospital departments before the implementation of schemes such as referral refinement or indeed repeat measures. And this is the progress we've made to date. So during the timeline of review, we only stopped looking at patients in the latter part of the summer there. So it's a slightly smaller scale service than the MECS in Lewisham and Lambeth because unlike 2,300 in 12 months, this was 1,400 in almost 2 years. So it's not a large scheme, but of course it's not the whole of the Manchester area. This is just in the central commissioning area. But nonetheless, 54% were discharged. So that's actually an improvement in effectiveness, if you like. There's an increase there in the proportion of patients being discharged. And we've seen 130 of those in the hospital as part of a false negative study to reassure ourselves about that we're not missing a trick. It's often been a concern of ophthalmology. Yes, but, what is the situation about those patients you're not referring in? Do they somehow present a problem? And we think the answer is probably not. I'll give you a lot more detail in due course when we look into this in more detail, but it's not our expectation that that's going to be a concern. In terms of those referred in, we've got outcomes data on a large proportion of them already. 13% discharged, 50% monitored, 28% commenced on treatment, and significantly there, that discharge rate, 13%, comparing very favourably with 11%, which was the initial figure. So in other words, only a very, very small number of patients that are false positives, if you like. So it's a scheme that works extremely well, just as we alleged with MECS. And I think the combination of integration between the community and the hospital has worked very, very favourably in both instances, both the Manchester Glaucoma Referral Refinement Scheme and the MECS scheme in Lambeth and Lewisham.